Delegate Derek Davis. Welcome to the House Economic Matters Committee. Today is Wednesday, September 9th, 2020. We have a presentation before us today. The Maryland Department of Labor, Secretary Robinson and Mr. Matt Helminiak, Commissioner of Labor and Industry. They will be before us today for a presentation on paid and unpaid leave, as well as a discussion that Moshe is taking to help implement best practices and protocols for COVID-19. So that we can not waste any time, let's jump right in. And Madam Secretary and Mr. Helminiak, thank you for joining us and welcome.
Thank you, Mr. Chairman. Can you hear me okay?
Yes, ma'am.
Perfect. So I'm happy to have with me Commissioner Matt Helminiak of our Labor and Industry Division at the Department of Labor. And he is the expert, so he is going to walk us through most of the presentation. But as you mentioned, we are going to touch on the topics requested: paid and unpaid leave available to employees of all size employers for COVID-related reasons, as well as a discussion about steps that our Maryland Occupational Safety and Health Division within Labor and Industry is taking to assist employers and employees in implementing those best practices. And also, we're going to talk a little bit about the type of calls and complaints that we have received. So with that, we will be open for questions once we get through the presentation, and you're welcome to interrupt us as we go if you'd like, but I'm going to turn it over to Commissioner Helminiak to walk us through the presentation.
Thank you.
Matt, are you there?
Is sound on? Host would like
Yes.
you to unmute. Okay, can you hear me now?
Yes.
Okay, perfect. I don't have there we go. That's our slide deck. Okay, so today, if you want to flip to the next slide, the topics we're going to be covering are an overview of leave, paid or unpaid, available to employees of various sizes for COVID-related reasons, and a discussion of any steps Moshe is taking to assist employers and employees in implementing COVID protocols, including an overview of the types of calls or complaints Moshe has been getting. Next slide. I'm looking at still the title slide.
Yep, I think we can move forward 2 slides.
I don't have a clicker. Well, anyway, so yeah, one more. There we go. The different levels of leave. There is employer-sponsored time off. Most employers, or many employers, go above and beyond what's the minimum required by law. Maryland has a leave law, the Maryland Healthy Working Families Act. And then at the federal level, there's the Families First Coronavirus Response Act. And next slide. Before we get into the paid leave, the House Bill 1663, the COVID-19 Public Health Emergency Protection Act of 2020, that was the bill that authorized the state of emergency. It also contained a provision that prohibited any employers from terminating an employee solely on the basis that the employee has been required to be isolated or quarantined. So even if there isn't a paid or unpaid leave available, there still is job protection for an employee that's quarantined. Next slide, so you can go 2 slides forward, actually. It's not moving. Anyway, so the Maryland Healthy Working Families Act, for those of you that that weren't around for it, it went into effect February 11th, 2018. It says that employers with 15 or more employees provide an hour of paid leave for every 30 hours that the employee works. And if you're an employer with 14 or fewer employees, you still have to provide the same amount of leave, 1 hour for every 30 that they work, but it's unpaid leave instead of paid leave. So, and you can flip to the next slide. We're got 3 slides behind at this point. The things that the Maryland Healthy Working Families Act can be used for, even though there was no changes to the Healthy Working Families Act because of COVID, the first 3 things that the Maryland Healthy Working Families Act outlines leave available for are all things that you could potentially say are covered by COVID. So to care for or treat the employee's mental or physical illness, injury, or condition, that would be COVID. to obtain preventative medical care for the employee or the employee's immediate family member, that's COVID, or to care for a family member with a mental or physical illness, injury, or condition. So if you have Maryland Healthy Working Families Act time, that provides you job protection, and if the employer is 15 or more employees, it provides you compensation for the time you have off. The next slide, so we're about 5 slides behind. Anyway, the federal law, the Families First Coronavirus Response Act, that went into
Hold on,
effect.
Mr. Helminiak. Can you hold
yeah.
on? Who are we working the clicker, or are you guys?
I don't have a clicker. There you go. No,
There we go.
one more. And one more.
One more.
Yep. That's our FFCRA is the next slide.
We need to go one more slide, whoever's running the clicker.
There you go. So the Families First Coronavirus Response Act went into effect in the middle of April. It was designed to help the U.S. combat the workplace effects of COVID-19 by reimbursing American private employers that have fewer than 500 employees with tax credit for the, well, we didn't need to advance yet. Well, you can leave it there. The cost of providing employees with paid leave taken for specified reasons related to COVID. It enables employers to keep their workers on the payroll while at the same time ensuring that workers are not forced to choose between paychecks and public health measures needed to combat the virus. And it's administered by the U.S. Department of Labor's Wage and Hour Division. So the Maryland Department of Labor doesn't have jurisdiction over it. It's a federal law, but we do get questions all the time, and we can help people when they have questions with it. There are 2 resources we usually point people to. The first one that you see there on the page is a web tool that they have on their website where people can answer a couple questions and determine whether or not they're covered. And then the other is the frequently asked questions. They update those frequently asked questions every couple weeks, anytime something new comes up, and they're written in pretty easy to understand language. So don't hesitate to recommend to a constituent to go onto that frequently asked questions. Next slide. According to the U.S. Department of Labor, the paid sick leave under the FFCRA is separate from any state or local law. So Maryland Healthy Working Families Act time can be exhausted, and then FFCRA would kick in. So the whole intent was not for the federal government to subsidize an employer's existing leave policy, but to add leave on so that the employees would have the ability to get paid. So the next slide. So there's 2 main sections of the FFCRA. The first section is the emergency paid sick leave section, and that's requires certain employers to provide up to 80 hours, so 2 weeks of paid sick leave to employees who need to take leave from work for certain specified reasons related to COVID. So reasons may include things like the employees caring for someone who is experiencing symptoms, they themselves are experiencing symptoms and seeking medical attention, or they're subject to a quarantine. So that's the first section. The other section on the next slide, the Emergency Family Medical Leave Expansion Act, that's the more significant one. That requires certain employers provide up to 10 weeks of paid leave, 2/3 of the employee's regular rate, and 2 weeks unpaid of emergency family medical leave to eligible employees that are unable to work or telework while caring for his or her son or daughter whose place of work or school is closed. So the covered employers, it applies to certain public employers and private employers with less than 500 employees. When they passed it, they said they didn't intend to subsidize big employers' sick leave policies. This was meant for small to mid-sized employers. A lot of federal government employees are already covered under certain portions. The small businesses with less than 50 employees are still covered, but some employers are able to qualify for an exemption if the requirement to provide leave due to school closings or childcare would jeopardize the viability of the business as an ongoing concern. So the next slide, I've got a list of the reasons why somebody could, and I'm not going to read those out to you, but that's the qualifications for asking for the waiver for the companies with less than 50 employees. That'll be in the PowerPoint if you want to read it. Next slide. There's 2 frequently asked questions that got added in the last couple weeks that are topical. The first one, my child's schools give me a choice between having my child attend in person or participate in a remote learning program. For the fall, I signed up for remote learning because, for example, I worry that my child might contract COVID and bring it home to the family. Since my child will be at home, can I take paid leave under the FFCRA? And their frequently asked answer is no, you're not eligible to take paid leave under the FFCRA because your child's school is not closed due to COVID. If it's open for your child to attend, FFCRA leave is not available to take care of a child whose school is open for in-person attendance. If your child's home, not because the school is closed, but because you've chosen for the child to remain home, you're not entitled to FFCRA paid leave. But if your child is under quarantine or has been advised by a health care provider to self-isolate or self-quarantine, you may be eligible. The other, next slide, the other frequently asked question that they added, my child's school's beginning the school year under remote learning out of concern for COVID, but has announced it will continue to evaluate local circumstances and make a decision about reopening for in-person attendance later. Can I take paid leave under the FFCRA? And the answer to that one is yes, you are eligible to take paid leave under FFCRA while your child's school remains closed. If the school reopens, the availability of paid leave will depend upon the particulars of the school's operations. So that is the leave parts. Do you want to do questions about leave first, or you want to save them all till the end and we'll do it after we talk about the COVID?
I'm probably going to regret this, but let's do it while we're on it so we can move on after, mainly because I had a question on it and I know I won't remember. I thought I had followed that emergency leave as well. I guess two things I wanted to be clear on. One, that the emergency leave, does it go away December 31st of this year? I mean, it's not an indefinite thing. It as currently written, it expires at the end of the calendar year. And then secondly, as it relates to that, is that I didn't think it was a new category of leave. Like if your employer currently offers it, this isn't a separate category of leave. You know, you could, like, I guess you'd be required to use the emergency component. Like if you have paid leave of some form, you'd be required to use that. Am I mistaken? And this is a new category of leave?
It's our understanding that it's separate and on top of. So if you already, like Maryland does, we already have Maryland Healthy Working Families Act, or your employer might have employer paid leave. This is for after that's exhausted.
After that's exhausted.
Yep.
Okay, yeah, that's sort of what I was getting at. That if they if you have that, you'd be, I guess, required to use that, or you could go to this other category.
And it's federally reimbursed. So this is meant to be something that the federal government has set up to help the businesses. You can, if you're a business that's covered under the law, you pay the employee the leave and you get it reimbursed as a tax credit. So this is a completely federally subsidized program. This isn't supposed to cost the employer a penny other than laying out the money as we go along.
Okay. Listen, I think I see in the chat, Delegate Walker, Delegate Wilson, Delegate Rogers, and then Delegate Charkoudian. We'll take them in that order.
Okay.
Thank you, Mr. Chair. So I know that what if a school is opening a hybrid model in which the students are going to school 2 days a week and then they're remote learning for 2 days a week? If you've got a fourth or fifth grader, how would that qualify for this FFCRA?
It's our understanding that you would qualify for the days that childcare wasn't available. So if your child's in school, then you wouldn't be eligible for leave on those days, but on the days that the kid is doing remote learning, you would be.
Okay.
Can we go next, Mr. Chair?
Yes. Jump right in behind when the question's answered. I'm sorry.
Okay. Just have a question about the FFCRA. When it comes to this basically 12 weeks of paid, that's a tax credit, correct? It's not a write-off. It's an actual tax credit dollar per dollar, correct? For the businesses?
Yes.
And secondly, if they offer telework as an option and the employee refuses telework, are they still eligible for FFCRA?
I'm not sure. My assumption would be no.
Under the three that I saw, that's why I was trying to figure out which ones that fit into the three exemptions. It's for somebody obviously under 50 employees. And if they're trying to set up a telework opportunity, but the other person, the employee basically says, my child's too young, or I just don't want to work, are they still eligible? That was.
If you can accommodate them for telework, like with time shifting, or come up with
Right.
some way to accommodate the telework and they can't do it,
It'd be
my
a no.
guess at that point is you would go for unemployment, not
Okay.
FFCRA.
Thank you.
So my question is, Ms. Helminiak, is with respect to the leave afforded for CARES, under CARES, what's the state doing to enforce availability with those folks that might be having a challenge associated with getting that? And then the second part of that, because sort of childcare is wrapped into this, is the state doing anything to address childcare concerns writ large?
Enforcement of FFCRA and CARES are both at the federal level, so we don't have any enforcement authority for an employer who isn't cooperating. We get along really well with the Baltimore office of the U.S. Department of Labor, so I can get people to the right person there, but we don't have any enforcement authority to make a business comply. With regards to childcare, that would be above my pay grade.
Okay, so in essence, you guys are just working with the federal government in terms of the enforceability piece, connecting those folks that may have issues.
Yes, sir. And I can take calls from businesses. We get calls all the time and emails from businesses that have questions about how to do it. So we're here. I'm in the office every day for people that have calls and questions. So I can help walk people through it, but in terms of forcing compliance, we don't have that authority.
Okay. All right. Thank you.
No problem. Delegate Charkoudian.
Delegate Charkoudian.
Thank you, Mr. Chair. Thank you, Commissioner Helminiak, for your presentation. And I think my question sort of builds on Delegate Rogers' question. My concern is related to quarantine and the pressure that a lot of employees are feeling to not quarantine when they probably should. There's a great deal of pressure, both financial for their families, as well as pressure from employers. We've certainly heard about that in some of the food processing industries. I've heard about it directly from some of the warehouse industries. And I'm trying to figure out, in some ways, this sort of melds into the next part of the conversation that we'll talk about in terms of motion, thinking about workplace safety, but it's related to the leave piece of it, because a lot of the leave you've talked about is our own leave in this state is related to being sick and caring for sick people. Some of the FFCRA seems to be tied to quarantine, but I'm trying to figure out how it is that the state government, specifically DOL, possibly also health, is actively educating employers, not just the ones who call you to ask about it, but the ones who maybe aren't calling you. In fact, the ones who may be putting pressure on their employees to come to work sick, either direct or indirect. How are you actively educating those employers, and how are we making sure employees know that they have the right to use the FFCRA so that they're not feeling pressured to go to work sick or to go to work after they've been exposed and thus exposing other people? Like, how is that active outreach being done by the Department of Labor to protect workers and to protect workplaces, especially folks in these frontline vulnerable positions, and folks who are living sort of paycheck to paycheck and feel really nervous about asking for flexibility?
In terms of outreach, I've done multiple presentations talking about FFCRA and Maryland Healthy Working Families Act. This presentation we're doing today is a clipped out version of a presentation I've given probably 6 or 7 times in the last few months. In terms of reaching every employee and working in the state of Maryland, I don't have an outreach strategy that can accomplish that, especially for a federal law that we don't have authority over.
To whom have you done the presentations?
I can get you a list. I've done them to the State Human Resources Association, so the Chesapeake SHRM, a couple of different trade unions. So I can get you a list, though.
Well, so to some extent, this goes, I think, into the broader occupational health and safety, and so maybe we can raise it again in a minute. But what about, has the state considered sort of actively putting out? I mean, there are labor posters and there's requirements, federal and state requirements about communicating with employees. And if, as a state, we're working really hard to stop the spread, and as people are going back into workplaces where it's crucial that they know that they need to quarantine and they can quarantine, it seems to me that the Department of Labor ought to be taking a more proactive effort to make sure people understand that they're not putting their job at risk and their finances at risk, because we want them to be making the choices that are healthiest for themselves, for their families, but also for the broader community. What about putting in standards that require some kind of communication to employees about these leave opportunities, which is tied to the broader ability to also quarantine?
There is a notification requirement with the FFCRA. The federal law does require posters and informing your employees. And I'll touch on it a little later. The Department of Commerce has a couple back to business pledges and guidance documents on their website, and that businesses can download and post that do walk through some of the quarantine information and what to do when you think you've been exposed. But FFCRA does have a poster requirement.
There is a poster.
But again, there is a poster and notification requirement in the FFCRA.
And how is that enforced?
At the federal level, unfortunately.
So really,
that's not something we have the authority to enforce.
Going in and looking in these workplaces.
Correct.
Okay, so it's not really enforced. The last question I have is, if the Maryland Working Families Act, does it address public health emergencies? Is that explicit in there? Would a quarantine fall under the Working Families Act, or would it only fall under the federal rules? The specific quarantine, if everyone's required to stay at home type quarantine, isn't specifically in there. But if the employee has symptoms, it could probably fall under the preventative health, the second one. Obtain preventative medical care for the employee or the employee's immediate family member. Most employers would probably say that counts. If an employee wanted to use their Maryland Healthy Working Families Act time for self-quarantine. We had that question come up a few times back in March, April, but honestly, I don't think I've had an employee ask me that question in about 4 months. Okay, thank you, Mr. Chair.
Mr. Chair.
Hold on, let me jump in for a second. First of all, is it possible to get a copy of the presentation?
Right.
We had a request to get a copy of the presentation, Mr. Helmeniak.
Sure, I can send it to you.
And then after that, if I can go to Delegate Valderrama and Delegate Brooks, I saw them in the chat requesting to speak.
Thank you, Mr. Chairman. Thank you, Mr. Commissioner. Just a quick question, and if I missed it, I apologize if it has already been asked, but I don't think so. I believe sometimes there's a different interpretation of what essential workers are. And so I just want to ask, are all the workers who perform quote unquote essential duties or work protected under this Working Families Act? Because my answer, my opinion would be no. And just to state that I know there are certain fields, just like health related fields. I come from a healthcare background, that there are certain positions like PRNs, agricultural workers, different occupations that are not covered. So I'm curious, because I know I've been getting inquiries about that, who's considered essential and who is not.
So the essential, non-essential is different than Healthy Working Families Act definition. So everybody's covered unless they're exempt from Healthy Working Families Act. So employees that work PRN, some contract employees that are temporary employees are exempt. If you're under 18 at the beginning of the year, certain types of agriculture, there's a handful of exemptions, but pretty much everybody who would be considered essential, with the exception of the PRNs, should be covered by the Healthy Working Families Act.
Okay, so I guess as a former healthcare worker, I would say that because they're contractual or just PRN, meaning as needed or on call, they're still essential. So I'm not quite sure what, and I don't know if this is your, your place to answer that question, but whether you're contractual or on call or as needed, I don't think that should exempt someone from, given that they are essential workers, especially in the healthcare field. Not really a question, just a statement. Thank you.
I didn't write it.
Delegate, oh, I'm sorry, were you finished, Delegate Valderrama?
Yes, Mr. Chairman, thank you.
Delegate Brooks.
Thanks, Mr. Chairman. Thanks, Mr. Helmaniak. Quick question. All of the conversation thus far and the presentation has been about to do with employers. What are there any consideration at all for independent contractors or non-employees in the FFCRA?
No. So if you're a self-employed person, you couldn't provide yourself leave. So you wouldn't need to provide yourself leave if you pay yourself. So that would fall under the pandemic unemployment assistance. So I think sort of it's covered. If you're self-employed and you're unable to work because of COVID-19, you can file for unemployment under the pandemic unemployment insurance assistance. So there is coverage, it's just not through FFCRA.
Okay, thanks. Thanks very much.
No problem.
All right, I don't see any more questions. So if we want to move on to the next, Delegate Wilson has one more.
And thank you, Mr. Chair. I just want to follow up with what Ben Brooks said. This is just a point of clarification. So any of these employees or employers that have all the people that work for them are on contract or they're contracted, this is not for them. Those aren't all in earnest. They're not employers. They're actually just contractors, correct?
If you don't meet the definition of an employee, then FFCRA wouldn't apply to you. That's correct. So I think a lot fall under pandemic unemployment assistance.
A lot of our constituents have that issue. They own businesses, be they barbershops, things of that nature, and They don't understand why they're not qualifying for the PPP and things of that nature. Although, to be honest, they've never really paid into that type of insurance anyway. But there's for clarification for all my colleagues is there are quite a few of these businesses out there, like Delegate Valderrama says, if you're a contractor, you're in a different relationship, so there is no obligation for the employer because he's not truly by law an employer. That's my understanding. Is that correct?
That's my understanding. And if you are a contract employee, you never paid into the unemployment system in the first place. So getting pandemic unemployment is not exactly the same as getting regular unemployment. Regular unemployment, your employer's been paying into the system. You have wages that you've got credited in the system, and that's where they make that determination. Pandemic unemployment, that's just federal government, straight money from the federal government that isn't coming out of the employer's pocket.
Thank you.
All right. I don't think I see any more. So let's go on to the second part.
Okay. So steps Moshe is taking to assist employers and employees in implementing COVID-19 best practices. So I broaden this a little bit because there's multiple agencies and multiple levels of government that come into play here. Not just Moshe. Moshe isn't acting alone in this one. So at the federal level, the Centers for Disease Control puts out guidance and everybody else filters off of that. So the CDC guidance forms the basis of the guidance that OSHA puts out, and that filters down to our different state departments. The Department of Commerce, Health and Labor all have pieces that work into this. If you want to flip to the next slide. So there's the CDC guidance that everybody points towards. OSHA puts out helpful guidance. They usually update it once every week or two. And it combines all of the OSHA guidance and all the CDC guidance into one resource page. And it's pretty frequently updated. And they have specific guidance documents for different industries, posters, and they're translated into multiple languages. Every week they'll put out something new. So last week they put out a new one about, I believe, chicken processing and seafood processing. So they're actively putting out new guidance documents constantly. So that all gets to us from OSHA. And next slide. The difference between Department of Health and Moshe and Department of Labor in this one. And I'll cover Moshe in a little bit, but Moshe deals with employer-employee relationships. The Department of Health is tasked with enforcing the governor's executive orders. So the governor in Maryland has pretty broad authority to issue an executive order. The mask mandate, the social distancing, the capacity limitations, all that stuff is enforced by the local health departments and the local police under the governor's executive order authority. The advantage of that versus having it go through Moshe is employer-employee. The executive orders through the health department can cover not just employees, but customers, citizens. So whereas if it was enforced only by Moshe, we would have a little bit of difficulty, say if a customer comes walking into the business and isn't wearing a mask. It's a little trickier to enforce that under a Moshe law because Moshe is employer-employee. The health department can enforce that because that's a violation of the governor's executive orders. So the Department of Health has people on the ground that can go in and shut down an unsafe facility if somebody isn't following the mask orders, isn't doing the social distancing, or exceeds their capacity limits. Next slide. Commerce. The Department of Commerce has acted kind of as a central clearinghouse for all the information that the different agencies have put together. Their Maryland Business Express website has guidance documents for a whole bunch of different industries. There were originally 12 advisory groups that they put together. Then they broadened that out and ended up with 15 of them. And they were small, mid-sized advisory groups that were trying to figure out what questions and concerns the employers had, what kind of concerns employees and customers are going to have. And the whole goal was to get information in the hands of the businesses so that their employees would feel comfortable coming back and the customers would feel comfortable coming back. So if you go to the next slide, the website for the Back to Business, it gives them guidance on how to operate safely, how to reopen safely. There's a Back to Business pledge that they can print off and sign and post. And the whole goal was to make sure the employees and employers were confident, because just because you're open doesn't mean people are going to feel like it's safe to come back into your business. So just because it's open doesn't guarantee people are going to show up. So next slide is the Moshe slide. So Moshe is, for those of you that don't know, it's Maryland Occupational Safety and Health. So there's federal OSHA, and then at the Maryland level, we have a state plan where we basically operate our own small version of federal OSHA. Every employer has a duty to provide a safe and healthful workplace to their employees. Moshe does this by implementing federal OSHA regulations, and we can also be more stringent than federal OSHA. So for example, Delegate Charkoudian's bill with the heat stress from last year, we're going to be working on a heat stress regulation that federal government doesn't have one. Maryland will at some point. Our requirement is we have to be at least as effective as federal OSHA, but we can go beyond what the feds do. And I always like to work in a sales pitch. Moshe isn't just about enforcement. They also have a consultation service that they provide. It's a free service where an employer can call and have a Moshe consultant come and give them free safety consulting services. So if an employer has COVID questions and they don't want to call up Moshe because they're afraid they're going to get inspected, they can call Moshe Consultation, and Moshe has a whole staff of consultants that can help them and guide them through the process. What Moshe can't do, Moshe can only enforce laws and regulations, so they don't have the authority to enforce a governor executive order. And they have to, in order to initiate an inspection, they have to have either a complaint, some kind of imminent danger, or they can have a program planned inspection. So if there's a high risk industry, Moshe can do random inspections of those, but we don't have the authority to just go into a business without some sort of complaint or an imminent danger to draw us in there in the first place. The next slide, the things that Moshe is doing to assist employers and employees. So they've developed some targeted COVID resource documents. So for example, how to handle COVID in dental offices, the differences between facial coverings and respirators. They answer technical questions from employers, employees, and citizens. When they do get a call that's about something that's enforced by an executive order by the Department of Health, they make sure that the caller gets the right health department the number for the local health department and the right contact information. They can utilize inspections and complaint investigations to ensure compliance with the Moshe regulations. So all the requirements about respirators, so Moshe doesn't have authority over the fabric, but filtering face piece respirator, chemical usage, sanitizing, all the PPE requirements, Moshe does have authority for those. They've been evaluating reports of deaths, initiating fatality inspections when warranted. They've got a repository of COVID guidance documents. They post links to that on the Moshe website. And then they've also developed a nice guidance document that explains different types of masks and what they do and what they don't do. The next slide is some more stuff that they've been doing. Oh, I'm sorry, the types of calls. So Moshe gets a significant number of calls, a lot more than they have been in the last couple of years. A lot of it is reporting work-related COVID infections, hospitalizations, fatalities. People call because of non-compliance with executive orders about social distancing and mask wearing. People call about the lack of or failure to require PPE. So PPE is personal protective equipment. So typically when people talk about PPE, they mean KN95 or N95 mask, hard hat, goggles, personal protective equipment. It's been in the news a lot lately, but if it was required before, it's still required. So just because there's a shortage of certain types of respirators, that doesn't mean you no longer have to provide them to your employees. We also get calls about lack of ventilation and the employer not following CDC guidelines about social distancing and masks not being required. Next slide. Employees at the workplace have tested positive for COVID or traveled out of state. They've been exposed to somebody COVID positive, or the employer is not informing employees or taking precautionary measures. The employee or a family member has an underlying health condition and is immunocompromised and they're afraid to return to work. Most gets calls about that. Employers requiring employees to provide their own masks, cleaning supplies, or PPE. Questions about the difference between an N95 and a KN95, fit testing requirements. So real quick to kind of touch into that. If you have a requirement for a respirator, the employer has a requirement to make sure that it fits properly. You can't, for example, have a full beard and have a respirator that fits tight against your face. So an N95 or a KN95, if you require that, you have to actually have a program. You have to do fit testing and make sure that it actually does what it's designed to do. So then they get concerns, calls about people wearing mandatory face coverings when it's hot out or they're doing heavy manual labor. And lastly, Moshe has a discrimination whistleblower enforcement authority where if an employee feels they were retaliated against by an employer after bringing up concerns about COVID, they can file a complaint with Moshe and Moshe will investigate that. So initially, next slide, from the March through May when everybody was quarantined or mostly shut down, the main complaint items they were getting were employers not having procedures or protocols to protect employees from COVID, employers not offering PPE, not offering disinfectants. Since things have started to reopen, the majority of the complaints they get now are mostly about executive orders about facial coverings and social distancing, and employees complaining about lack of contact tracing and lack of employees following quarantining requirements. So for a lot of those, we'll refer them over to the health department. The investigations, the next slide. Moshe has investigated 37 accidents and 21 fatalities since March 16th. So accidents, falls, crushed by, struck by, amputations, those are unfortunately usually the top three. With fatalities, COVID-19 is the #1 fatality source since the quarantine started. Part of that is because the quarantine kept a lot of people away from work, so they didn't get into the accidents that they might have gotten into otherwise. There still have been 3 fatalities by falls, 3 crushed by or struck by, an electrocution, a tree care, and a horrible chemical exposure, one that I will not go into detail about. But that was a pretty nasty one. So that is the end of my Moshe slide deck. If you guys want to ask questions about it,
I'd like to, and I'm not exactly sure of where this question belongs. It very well a question for the legislature or the local departments, but increasingly I see some of our businesses and more specifically their workers, the workers are put in an awful position. On the one hand, we're requiring them to enforce our face covering laws, and increasingly we're seeing pushback from residents, their customers, or whatever the case may be, and they are being attacked, assaulted, things of that nature. And so they're in like a catch-22. If they don't enforce the face covering laws, they get dinged. If they do, they could get dinged in another way. So how is that? I mean, does that come up? Does that fall up under you guys? Or, I mean, do y'all have any, or is that just strictly a law enforcement and maybe a legislature role in terms of there's got to be some sort of reprimand or punishment for assaulting people who are merely following state orders or local orders?
So it thankfully doesn't come up as much in Maryland as it does in other states. By having a governor that's been very consistent with the mask wearing since day one, there hasn't been anywhere near the pushback that you've seen in other states. Having the guidance from the Department of Commerce to put the signage on the door saying that if you want to enter, you have to wear a face covering, having the executive order requiring everybody to wear masks, that has kept it to a minimum. We do get a handful of calls, but really not that many. The catch-22 for the business is if somebody has a medical exemption or is medically compromised and they can't wear a mask, the business is limited on what kind of questions they can ask to basically say, hey, can you prove it? But the business can say, you can't come in here. So they would have to provide some kind of curbside service or something, but you do not, as a business owner, have to let somebody in that isn't wearing a mask. Even if they say that they can't wear one, you can come up with a alternative. But it does put, unfortunately, some people in a rough spot where you've got a young person at the door of a Walmart having to enforce the mask guidance. I know the Walmart in Eldersburg, they now have a security guard there being the bad guy instead of the nice kid. But yeah, it's unfortunate. But thankfully, we do not get anywhere near the number of calls about that as other states do.
Gotcha. Delegate Charkoudian.
Thank you, Mr. Chair. I have a couple of questions. The first is that I was really disappointed that the governor chose not to implement an emergency temporary standard that several unions and organizations called for, similar to what the Virginia Occupational Safety and Health Commission implemented. And the public comments from the governor were to the effect of the health departments, essentially can deal with that. I'm not sure if that's the whole story, and I'm wondering if you want to speak to that. Really, you talked about enforcement versus consultation, and I've heard a lot about the consultation and support for businesses that you've provided, and I think that's a really important piece of it. But the enforcement is an equally important and maybe more important piece of it, especially when lives are on the line the way that they are right now. And so it seems to me that potentially some of the challenges for you have to do with enforcement within the general duty clause. What Virginia has done seems to be a model, and the response that health departments can deal with it is really inconsistent actually with everything that you've shared, which is, what pieces of this fall under OSHA, the guidance from OSHA, the guidance from the CDC, and the pieces of where really there is this interconnection between like in warehouses, not with the public, not like restaurants, but warehouses and food processing plants and so on. Where it really is occupational safety in the way that a bloodborne illness would be an occupational. So now we're talking about a airborne illness, but bloodborne falls under occupational safety very clearly. And in the workplace, sort of this does in the same way. We wouldn't put that under the health department. And so I think I have some other questions about the investigations that you've done, what the findings have been and the in-person investigations. But before I get into those, maybe if you could just speak to the decision by the governor, and I would urge the governor to revisit it, but this decision to not go forward with an emergency temporary standard the way that Virginia and a few other states now have.
The negative of doing an emergency temporary standard is it locks into place basically the CDC guidance as of the date that you put the standards in, and the CDC guidance changes pretty frequently. Most of what is in the Virginia guidance is covered under the Department of Health with the mask and the social distancing. There are a rating system that's in the Virginia temporary standard of low, medium, high risk levels. But other than that, almost everything else would be covered by what the governor's authority has. A lot of other states, the governors don't have the authority that ours does to enforce the mask wearing, and they needed to do an emergency temporary standard to get it. Maryland has a relatively powerful executive, so they're able to do it with the executive power.
Yeah, I mean,
But
with all due
the
respect,
Virginia one is a pretty basic ETS.
the Virginia order
Okay.
is, I don't know, like 40 pages long. It's quite comprehensive. It's a lot more than what is in our health directives. I can send it to you if you haven't had a chance to take a look at it.
No, I read it.
I guess my next question, and maybe depending on the answer to this question, it's tied to this question, but if an emergency temporary standard is needed, can you talk about, I've heard from both warehouse facilities, as I said, as well as food processing facilities, about complaints that have gone uninspected and been closed. And I'm wondering if you can just talk about the number of complaints you've received. The OSHA page indicates 96. The number of complaints you received, how many in-person inspections you've done, and then whether you have informed the employer that you are coming to do that in-person inspection, as was the case, I think, in a pallet recycling facility in Baltimore. And my concern is just that, we have workers going into work and we need to be able to make sure that they're safe. And so there are PPEs that are available for Moshe inspectors to use. And can you just walk through how that works in terms of how you receive a complaint, how you investigate a complaint, in-person investigations, and how you do it in a way that ensures you're actually capturing what's happening at that facility and not sort of the best version of it that an employer might choose to put together for your visit?
So I don't have specific answers on specific investigations that Moshe does. The way the Moshe law is set up, as the commissioner, I'm the appeal authority for Moshe cases. So they don't inform me about specific cases, because if the employer appeals a citation, I have to hear it in a quasi judicial setting. So I don't have specific information on any of them. I can put you in touch with the Moshe guys, and they can answer them. But in general, if a complaint comes in from an employee or their representative, somebody at Moshe evaluates the complaint, make sure it's a valid complaint. And if it's a valid complaint, sometimes it's something that's in imminent danger. They'll send an inspector out. If they are going to send an inspector out to do an on-site inspection, they don't tell the employer ahead of time. That's an unannounced inspection. But sometimes, especially during the early COVID days, when you had some facilities that, like healthcare facilities, where they access was relatively limited, they would reach out by a phone call or a fax. So federal OSHA and Maryland both had a modified phone fax response where they could just reach out and get some information, some basic information, find out if the employer does have a program, and then if they didn't find the response to be satisfactory, then that would trigger an inspection. But with regards to specific cases, I don't have knowledge about any of the specific cases.
Do you know how many cases Moshe has investigated?
The data I thought was about 600 complaints they've received, and I don't know the exact number, but I can get the number of investigations.
What I'd be
inspections they've
interested in knowing is the number of complaints, the number of investigations, and the number of in-person investigations, and to whom it does seem that it's against the law to inform an employer that an investigation is happening, except under very limited circumstances, and yet that seems to have happened in at least one situation. To whom should the employees or their representatives in that case communicate that that's the way the investigation happened? Like, would they communicate that to you? Is that an appeal? Is that the kind of thing that you would take as an appeal?
If they get it to me, I'll figure out who to get it. The question's never come up before, so if someone does ask me, I'll get the answer to that one. But I'll get the data on the number of complaints, number of investigations, and on site versus not on site.
Okay, I'm nearly done with my questions, Mr. Chair. I guess I want to make sure I understand. Is it also your understanding that it would be a violation of federal law to inform an employer that an inspector is coming? Is that your understanding of that as well?
Yes. Yeah,
Okay.
to give somebody a heads up that an inspector was on the way out. Yeah. And now an employer can hold you up at the door. They don't have to let you in immediately. So there is a little bit of they do have rights to not let you in just the second you show up. So it could be a case where there was, maybe it sounded like they got a heads up, but it could have been Moshe ended up needed to get, sometimes you can have to get a subpoena or get local police to help get you in.
Okay.
But an employer does not have to let you in immediately when you get there.
Well, I'll make sure to find out more about this situation, and I'll communicate with you. I'd be interested in the data and specifically if I'd be interested in seeing the follow-up data on the investigations and what the findings have been. So if you can pass that on to the committee. And also would that be by industry as well? So we could see where the industries were that had the concerns and where you had findings?
Sure.
Okay, thank you very much. Thank you, Mr. Chair.
I think I'm next. Am I next, Mr. Chairman? Delegate Queen.
Hold on.
You can go ahead.
Delegate Queen.
Oh, okay. Thank you, Mr. Chair. Thank you, Commissioner. I just have more questions around process type of things. So you mentioned we recently got some standards from OSHA on the seafood and chicken processing. So from a process standpoint, will you now go out and provide any more detail or training to employers to make sure if there's some changes they need to look at or to focus on? How is anything communicated, or how would those things be communicated if we needed to focus on something different?
As far as I know, all that stuff is posted on our website. So
okay, so we just asked them to look at that?
Right. And okay. I'm not sure if we've done any kind of emails out to the industry or not. I can find out. Okay.
That would be, maybe just to give them some heads up or make sure that they're looking at that. So as we look at things in that arena, if we have more infections, especially in the meat processing, and more infections or issues, what's the protocol to start reporting that to the health department? Is everything we find reported, or do we have a certain number? How do we identify any sort of sense of urgency, especially in the meat processing area?
I'm not sure I understand the question. So if there was an outbreak at a facility, or if there's
every time you find maybe a COVID case, do you report them all to the health department, or is there some sort of, certain number you have to do? How do we have this action, this communication with you in the health department, I guess?
The employer should be reporting those to the local health department, who then will do the contact tracing. My understanding is at least most of the facilities have USDA inspectors on site.
Okay.
So if you've got a poultry processing facility, you'd have a USDA inspector inside the plant while they're doing the work. So Maryland does have a fair number of poultry processing, but it's a whole lot less than a lot of the other states, the agricultural states in the Midwest. So it is big on the Eastern Shore, but it is not. There's not thousands of them.
And so, is there any statewide tracking of the numbers, though, amongst the meat processing, and compare it to other states?
I don't know what the health department has on that one, or USDA. That would not fall under what we enforce.
Okay, so you wouldn't have any jurisdiction over that?
No.
Okay, thank you.
Delia Valderrama.
Thank you, Mr. Chairman. Again, thank you, Mr. Commissioner. Kind of just a two-part question. So as you know, many of these workers, especially in these processing plants, are migrant workers, as we all know in the state of Maryland. So I just want to find out, what has Moshe done, if any, to conduct outreach to these workers? Like, for example, a lot of them, I mentioned migrant, are there materials so that they know what their rights are, both, most especially in Spanish, or Creole even for that matter? And to piggyback on that question, because a lot of them are migrant workers, what steps, if any, have been taken? Because a lot of these workers, entering our great state of Maryland, especially for the harvest season, are there any, how should I say, when they arrive from other states and other jurisdictions, especially other countries, a lot of them with very many high infection rates, what are we doing to protect our workers that are here too, but to protect them as well, if any? Thank you.
My knowledge of that, I think that falls under
As
the
far as
health
testing's
department
concerned,
or
I
the
apologize.
USDA, but that's not a Moshe thing. I know that there's workforce development unit handles some inspections of housing, but for the most part, that's all outside of my scope.
But just so I'm clear, you're saying Moshe doesn't have any processes in place as far as testing migrant workers that are entering the state for the harvest season? Did I hear that right? There are no.
That's not something that Moshe has the authority to do.
Okay. Thank you, Mr. Chairman.
Anyone else?
Yes, Mr. Chair, how are you?
Hi, Delegate Fennell.
Andrew, the question I want to go back in reference to, I saw there was 12 cases of COVID. With the 12 cases of COVID on a Moshe, in reference to, is this was contracted by other workers? Is that the reason why that y'all did it that way in reference to the 12 cases of COVID?
The 12 fatalities?
Yeah, the COVID, it says COVID-19 and it said 12 cases of that.
Right, those are 12 workplace fatalities where the employer
Okay.
notified Moshe that an employee died due to COVID that
Okay,
they linked to the job.
and that's what I want to explanation of. Thank you so much, I appreciate it, thank you.
No problem.
Is there anyone else? Hearing none, seeing none. I'd like to thank, Madam Secretary, if you're still on with us, are there any final words or anything you'd like to say before we let you and Mr. Helminiak go?
Thank you, Mr. Chairman. I'm still here, of course. And no, I just wanted to thank you for the opportunity, and we'll be happy to forward the presentation and answer any follow-up questions that you may have.
Well, it's my understanding, thank you for mentioning that. I got a note from our staff that is actually up under meeting materials on the website, and each of you, if you check your, they sent an email to each of us with the link. So if you check your email, there's a link to the presentation. So that won't be necessary, but I do thank both of you for taking time out to come and brief us on this. I can speak for me personally. I've been working with a number of your staff members on a number of issues, and certainly I know we're under trying times, and everybody has a lot going on, but I certainly appreciate the time that your office has afforded me as we've dealt with a number of issues. So I wanted to say thank you for that. To the members, Mr. Helminiak, to you as well, great job today, and to the members, I'd ask if you could hang around for just a quick moment, won't keep you long. But if there are no further questions, thank you all so much for coming on today, and we'll see you again.
Thank you.
Thank you.
All right, anybody that, I guess we got the rest of the committee down. Now, first of all, guys, we are still on, still being recorded, so we're not alone. Keep that in mind. But I wanted to just, like I said, just sort of reiterate what we had talked about earlier. We don't know what session's gonna look like, what form or shape that it's gonna take. I've been talking with the vice chair, obviously not enough. I'm sure she's just thrilled to be waiting for calls from me though. But we're gonna try to be as aggressive as possible to get the things that we've talked about during session, the things that we referred to interim study. We're gonna do it this year. We're gonna do some things with interim study. It wasn't just a polite way of, letting our colleagues down. I really want us to take full use of this medium. I try to be mindful of your time, so I didn't want to, in the normal times, drag you all to Annapolis when I know that there's a lot going on. But because hopefully this is a bit more convenient for everybody, I wanted us to, really hit the ground running. If you all have questions or concerns, please get them to me or the staff. I can't promise you we can have a full briefing on everything, but, we'll certainly try to get the information that we can. We'll let DLS know or whoever the appropriate body is or entity is, so that we can get feedback on it. And that's sort of where we are. Is there anything that you guys off the top of your head that you hear that's going on maybe, or some things that you're concerned about while I have you at this moment, and maybe we can, maybe take a look into? Is there anything that's jumping out or that you think we need to look at? Jay, I just saw your hand, and then PT.
Thank you, Mr. Chair. I believe now, like we kind of talked about it before, but it seems like bills are coming due. So I got some constituents of mine showing me like the letters from PEPCO, WSSC, and it's like, get these payments done. And I don't know if people have it. I know it seems like the utilities want, they want to get paid for their bills. We all need them to as ratepayers. But if folks are still on furlough necessarily and don't have that, they're starting to say they may have some income in the house, but they're really, falling behind in this. And it seems like the utilities are asking them they're trying to say either get on this income payment plan where if you don't make certain X amount of dollars, you get it free, or they work it out. But if you do have an income at all, some people say they've been denied for it, and they got these balloon payments coming due. So new to the committee, I don't know how we handle that, but it seems like with it being utility, maybe something we should look, inform me on it.
Is Bob on here? He's not. What I know is that the Public Service Commission actually, in the last 2 weeks, they had some sort of a hearing, or they required something of the utilities. Forgive me for not. Charkoudian?
Yeah, actually, did you want a summary of the Public Service Commission hearing? Because is that what you were looking for?
Yeah, I know they did something on this.
They extended the moratorium on cutoffs to October 1st, and then they require 45 days before the cutoff could happen. So Delegate Walker, you're right that in fact, people could be getting notices now, and then cutoff notices could come after October 1st. And then there would be 45 days before the actual cutoff would occur. Technically, there's money available, and this was part of the discussion that happened at the Public Service Commission. Technically, there's money available within OHEP, and we had the briefing from them last fall. Folks might remember. It's the Office of Home Energy Programs, but it is something that I've started working on educating my constituents about. It's a very complicated process. It's a very confusing process to go through. It's an online application process. Usually local community action councils or local DSSs will help people through that, but because the offices are closed, it might be worth getting some information or doing a hearing about realistically, how do our constituents, there is money, there's extra money, CARES money came into OHEP. So there's actually money sitting there that folks could access, but it's not simple to get access to. And so that's really one of the challenges right now. So PSC made their decision based on the fact that, there's money sitting there and nobody's accessing it, which is true, but figuring out how people actually access it. And to your point, Delegate Walker, people start to get the notification. They don't necessarily know how to go through that process. So
is it income based? I mean, that's my
OHEP,
absolutely.
OHEP is income based.
So if somebody has a household and you household that was making, $120,000 household income, and now one person is laid off, and then it goes down to $46,000, let's say, I think that's what I was hearing one of the numbers was, then do you not, because you don't qualify to be a low income household, are you stuck trying to make up the difference for that?
So that's a good question. And I think this is where it gets kind of complex. There is CARES money that came in. So there's the standard OHEP money that's always there from like LIHEAP and whatever the federal programs are. And then there's some additional CARES money that's specific to the pandemic to help with that may be more flexible, the way some of the CARES money on unemployment was. But I think this is where it gets confusing. It's confusing to apply. You need everybody's social security numbers in your household. You need everyone's social security card in your household. You need to upload documents. So that's a problem, the access to it. And then I think there is that question that you're asking is there more flexibility now because people have lost income, even if they wouldn't normally apply? And I don't know.
Yeah, and it seems like, just thinking realistically, okay, more people are at home now. So, I don't know about you, but my electricity bill went up during this time because I'm at home, I would normally be. So if you have more people at home, more kids at home, more electricity being used, more water being used, things of that nature, seems like we're just setting some folks up to, not setting them up. I just wish there was something we could do, or we had a plan or course of action that we can ask utilities for some type of forgiveness or something like that.
Here's what I would say. I mean, just for discussion purposes, I'm not advocating against anything, but sort of the dilemma or the thing we're going to have to confront is this, that the energy and stuff that or the electricity, for example, that a PEPCO, BG&E, they don't produce it in and of themselves. They purchase it. And so if they're purchasing it based upon, this expected money from the rates, and then it's not there, then I think through the PSC, I think it's going to be based back into the rates. If we don't have some sort of other, I don't want to use the word scheme, but some sort of other plan, then I think ultimately, because they've got to recover that money, that's a prudently incurred cost. I think the way that will work, and that's why I was going to ask Bob to just sort of verify what I'm telling you all, that ultimately they would have to recover that money back somehow. So it would be baked back into the rates, unless someone else.
I get it, but it's like we know what the school system did. They made sure everybody got those Chromebooks. They got map books, so you can learn. You had a way, and the school system kind of eating it a little bit. We'll come up with more pay for, but in this case here, it's like, okay, do we not have the ability to have the utility companies eat something, or take a little something? I mean, just to say we're not going to cut you off for 45 days, but yet the income is not there and your income level is above the threshold. And I'm talking, in this metropolitan area we all live in, we all have said it before, household income of $40,000, $50,000 in the DMV, family of four, you're struggling. They're struggling. So it's like, what do we do? At what point do we say, okay, what can we do to help out people that way? I just think that people are going to start stressing out about
and that's the dilemma, I think, for this committee. That's some of the things that
let's do it, baby. That's why I'm here.
Yeah, that's something we're going to need to talk about.
Mr. Chair, perhaps in the short term, it may make sense to ask OHEP and Department of Human what are they now, Services, and others to come and just lay out and to ask them to, how can we actually make it, and maybe even the Office of People's Counsel, how can we make it more accessible? So in the short term, Delegate Walker, I'd be happy to work with you to look at how we have shareholders pay for some of the pain in legislation next session. But in the short term, I think there is a real need to get people onto their energy assistance, and it's not clear how that's going to happen. It's a very complicated process, so I would welcome and be happy to work with anyone to
you know what, that's a good Delegate Brooks, I was going to say, something your subcommittee should step forward and do as well, to see if they're like the MEAP money, for example, whatever monies that's out there, the People's Council or public that they know about. We need to make sure that money, at a minimum, none of that money is just sitting there, that they, everybody that's eligible, that they are applying for it. Obviously, it's not going to be enough, but at a minimum, we need to make sure that money is at least people know about it, the eligibility requirements, and that, that they get in the queue, so to speak.
Right. Yeah, the other plan, that the USP plan, the USP plan, that which provides financial assistance on the utility bills itself. So there's some other plans out there that possibly they could perhaps get assistance from. So.
My last thing I'll say.
Let's check and find out where those, in terms of where they are, and available monies. We probably need to find out what we have out there. CT, I saw you trying to get in. You're muted.
While we're waiting on CT, Mr. Chairman, could we also make, this is Delegate Branch, could we also make sure that we, I heard Charkoudian mention things were hard to access, that money is just so hard to get to because of the application process. Could we also have someone look at or one of the committees to look at the application process for accessing the monies that are available? We shouldn't have money available sitting there that people don't know how to get to, or it's so cumbersome to get to.
Ben's volunteered for it.
Sure did. All right, I certainly will.
CT.
And while you're waiting on CT, this is the last one, if I could quickly. Do we know, did any of our utilities receive any, it's a follow-up question too. Did any of our utilities receive any federal dollars for this, for this COVID? Did they receive it? Did anybody know top of their head?
Say that again.
Did any of our utilities in the state of Maryland receive any type of federal aid from the government regarding the COVID crisis?
PPE, things of that nature, or PPP.
I don't know. That's a good question.
And ask what they've done.
Go ahead, CT.
Mr. Chair, just again, this is for all the colleagues because I've been having a lot of issues here in Southern Maryland. And the reason I bring it up before, obviously, hoping that we'll have the Department of Labor on again or some representatives, because we're still having a lot of the same issues with the UI claims.
Yes.
And that's why we didn't really get to touch on that today about not receiving communication, never reaching back out, individuals waiting several months just to get their issues resolved. And then the next week the issues that issue comes back. And now they're on the bottom of the list, on the waiting list again. In addition, we're having issues now with fraud because they're being told that their UI claim is fraudulent and they have to repay the money back when it's not fraudulent. It's like the burden goes back on them. And I know we didn't get a chance to cover this, and I didn't want to drag this out, but I believe most of our colleagues have the same issue. We're trying to resolve these individuals' problems, and it seems like the Department of Labor is still kind of where we were 3-4 months ago as far as their timeliness or lack thereof, and their inability to actually solve these individuals' problems. I would like an opportunity, obviously, for all the rest of my colleagues to chime in, but we really do need to have another sit down with DOL to have them explain why we're still dealing with these, why my constituents are still not receiving checks. It's been 4 or 5 months. And that's obviously my issue. Thank you.
Let me ask this before we go to you, Chris and Courtney. NED subcommittee, the unemployment subcommittee, I know that while we as a full committee haven't met, they've met bi-weekly. And I think Laura, the staff, has met with them in the opposite week. So there still has been communication going. Has that come up at all, Ned or Laura, in terms of where we are with that? Because I'm sure you all are still getting constituent complaints, Ned, and the subcommittee. Has that come up, the thing CT is raising, has that come up at all in your meetings?
Yes, it's come up once or twice. As a matter of fact, Mr. Chair, I was just making a note to myself at the next meeting to bring that up again, to put that back on their radar. It came up in our first few sets of meetings. It hasn't come up recently.
I've got like 8 issues, Mr. Chair, having to do with unemployment insurance. And again, a lot of them are repetitive because we brought them up before, but they have not changed. And the one I'm most worried about from a legal aspect is the fraudulent activity or claims for fraud. And there are individuals that apply for small unemployment assistance and they get a $5,000 check. Unfortunately, these are individuals that need this, usually also don't have any really good financial literacy. So making sure that they also know that they might want to put that in the bank if they don't know where they got it. So we're running into these issues that's become more and more prevalent, which I'm sure it is with many of your constituents as well. And I don't want to see them get any legal trouble, as well as the fact that I believe that our DOL isn't really doing what they need to be doing still. And I mean, I appreciate Ned, what they're talking about, but the fact that it's fallen off his list, it's on our list every week because we have an ongoing, as I'm sure everybody does, an ongoing spreadsheet. That spreadsheet's not coming down like it should. It's going up. And the fact that it's increasing means this is still an active problem.
Okay.
It is.
Chris, let me go to Chris, Courtney, and then Talmadge.
Yes, thanks, Mr. Chairman. I was just going to simply say during the actual hearing, I did reach out to the chairman, and I apologize, Mr. Subcommittee Chair Carey, that I did not reach out to. I wasn't even thinking about that, but not ironically and not surprisingly, exactly what Delegate Wilson just said, that has been my daily issue. I'm not even exaggerating, daily issue. And I've had constituents reach me because they knew this hearing was taking place today, asking if we could discuss it. And I, as a courtesy, I asked the chairman because I did not want to start asking it if it was inappropriate since it wasn't on the agenda. But I can say that this one particular constituent, and I'm sure we all have them, same as Jay's and Veronica's, I've got people calling constantly, and thankfully my staffer, because I don't have a staff like everyone, everyone has like 5 chief of staffs and everything, who's been very diligent, very diligent in keeping up with these constituents, putting their claim in consistently to the point where I don't think our emails from the actual legislator are having any kind of impact on Andrew, on anyone in that department, for that matter. And I actually have 2 constituents who said they were going to get a call back within 2 weeks, and it's been months. No one's getting back to them, and that's just not right. I mean, and I know, they say they have this process that was taking place and new trainees, but it's 6 months now. There has to be something, that has to be in place. So I'm just reemphasizing what Delegate Wilson said, because that has been my only constituent issue since this whole pandemic started, the only one.
Johnny, I'm sorry, I just saw a note. I think I may have missed you, that you had a question at some point. I apologize. I never saw you, but if there's something that you wanted to say now, please do.
Thanks, Chairman. I feel like I should chime in on unemployment because I've had the same experience as everyone else. And I'm also on that task force that works with the secretary. And I agree that there are many facets of what we're dealing with all of our constituents regarding unemployment. But my question was for the hearing earlier, and I guess it's not the time, but the CDC and NIOSH both went down to most of the poultry facilities on the Maryland part of the peninsula, I think Virginia and Delaware. And I think there was a lot of information that the state picked up from NIOSH and CDC, but I wasn't a part of those discussions. And I'll reach out to somebody to make sure that information makes it around to the committee so everybody gets that. Thank you, Chairman. Good to see you.
Good to see you. Delegate Watson. Sorry.
Yes. I'm also on those calls, and I would like to agree with Chris and with CT and Johnny. It's clear from hearing the discussion every other week that there's a manpower problem, and that really hasn't changed. I do think that they have gotten better, but they're still woefully inadequate in terms of their response to constituents. There's a lot of systemic problems, and the fact that, and they're being very reactive to the problems instead of proactive. I think that we should have another briefing, but I think we should be careful how we structure it. And maybe with the chairman of the subcommittee set up specific parameters that we want them to address, getting the input of the full committee. Because my next question was, should we be, and I think we should be, working on some legislation for the session to try to correct some of these problems that they either have not been able to correct or do not want to for certain reasons. So I recommend that we do another briefing, but it be structured through our subcommittee chair, and that we, if anybody is thinking about legislation, that we coordinate on that to make it as effective as possible.
Okay. I've actually, and more needs to be done. I've had conversations with Delegate Charkoudian, and I've asked her to have conversations with Delegate Carey about some things that have come up, some suggestions that they appear to be best practices. Obviously, there could be more than that, but just some common sense things that, pandemic or not, they would be appropriate changes that would be very beneficial to our constituents that just for whatever reason aren't doing. So we'll definitely have those out at some point to the committee just as soon as they all get together and talk. But if there are any other ideas that you all have, and certainly we'll continue to research and find out about best practices that we could add. But yeah, those, you're absolutely right. Those are, there are some things that why we weren't doing it anyway. It took a pandemic to illuminate it, but how we got here, those are certainly things that we can do to make the process better for our constituents. So we'll definitely do that. Is there anybody else? Did I miss anybody?
Mr. Chairman, just allow me to pile on with everybody else. This that new system that they put in place, apparently.
I think you froze, T. All right, while Talmadge unfreezes it, anybody else that want to jump in until Delegate Chi?
Hi, thank you, Mr. Chair. Hi, everyone. I heard several of you commenting on the unemployment insurance situation, and I agree that is still a persistent issue of not getting responses. So what I heard when we asked that question, and I'm on the work group as well, from Secretary Robinson was sometimes people don't pick up calls when they are called. Like if they were promised a 2 weeks response or something, and those workers actually called and the people thought they were scam or something. They just did not pick up the phone. So that is a technical issue that there should be a way to resolve. And back to the point the chairman just made about legislative initiatives. I'm thinking, and I asked that question during one of the calls, I didn't get an adequate response, which was, it's one thing to make people wait. It's another to not know where you are in the queue, right? I mean, we are living at an age where there should be a technological solution to letting people check where they are in the process. And it should not involve human beings having availability to check into the system. Why can't we just automatically give people the ability to look up? And when we asked the question, we just didn't get a straight answer in terms of what our capacity is. I mean, these things should be able, should be resolved one way or another.
Delegate Branch, we stepped away. You froze on us, and we couldn't hear anything. But it sounds like you're back.
Yeah, well, things never got better here in Baltimore. I mean, my list is still just as long as they were before they switched to the new system. Something is vastly wrong, and I don't know what that could be. I have one constituent like Chris that actually lost their home because they couldn't get the checks on time. Actually got foreclosed on. So, and which is stories that you don't want to hear. But we have to have another briefing. If we do have one, I'd like for them to come in prepared and demonstrating how the new system works and how we can be assured that our constituents are going to be receiving a better service. This is absolutely ridiculous. I agree with everyone else.
We'll definitely do that. I guess my point or my concern or my issue would be, I sort of got it when they were getting 50, 60, 100,000 claims in a week. That thing, I understood. But now it appears to be a far more manageable number, around 10 or 12,000, in that ballpark. And while that's still a large number compared to what they're doing, the 2,500 a week they're used to doing, it's far less than those other numbers. So you would intuitively, you would think that they would have a handle on it. It's much more manageable, et cetera, et cetera. So, I don't want to, I don't know all the issues behind it or whatever, but I do know, like you all, I still get the job, those calls, and I get them to my other job as well. People saying that they've applied in June and July, early July, it's still more than 2 months and they haven't gotten benefits. And, I don't understand that either when it's gotten down to a much more, what I think is a much more manageable number compared to before. So we'll find a way to get that in. Delegate Chairman Carey, in the interim, in between us getting them back before the full committee, Laura, you guys, if you can let them know that we had this discussion and, the members are still very concerned that there are a large number of requests that we're getting from people who've been trying to apply for months, that sort of thing. If you all can do a deeper dive into that for us and let them know that at some point, we're going to want them to come back again and continue their conversation with us. But while you all are still having your bi-weekly conversations, if you can bring that up then, and hopefully we can get some resolution to some of these things we're hearing.
Mr. Chairman, just a quick question for Delegate Chi and Chairman Carey, since she mentioned that they have the opportunity to meet with Secretary Robinson on a more regular basis than the rest of us. And Delegate Chi, you mentioned that she said there was a technological issue. Well, I had constituents saying the same thing. So my question is, are you saying, or is she saying that when they make that call and people think they're scammers, so they purposely don't answer the call, they don't leave a voicemail? So it's like one and done. We called you, you didn't answer, done. Then they get shifted back to the bottom of the queue. Is that what they're saying? Because I don't believe people, if they don't answer, wouldn't they let them know that they were contacted? Because then they don't know they were contacted.
Yes, I believe they do leave voice messages.
Yeah.
Courtney, do you want to jump in on that? I think you were also working on this.
Yeah, they do, but sometimes we don't know if this has been fixed or not, but the caller ID doesn't necessarily identify that they're calling from the Maryland Unemployment. So the person waiting for the phone call might not pick it up. So that's one simple problem. We'd like to see that fixed. But then they do leave their name, but then they can't get back to them. Or they say, I will try you again. And then they, days go by. So yeah, it's, there are systemic issues for sure. And they are just trying to, I see it as they're trying to put out fires and not try to solve the systemic problems.
Mr. Chairman, we can certainly run this down, but we should probably consider having another full committee briefing at some point. I mean, there are a whole lot of issues out there. We talk to them every couple of weeks, but Delegate Branch's issues, Delegate Wilson's issues. I mean, we need a mechanism to bring this to their attention and have them answer for it. I mean, they tell us, everything is sunshine and roses, and it's not. So, it may be to our benefit at some point to bring them back in and have them talk to us about these issues. But in the meantime, Laura and I can certainly run some of this down.
Okay. So we got that, we got that focus, and yeah, we'll set up something for the full committee at some point a little later into the interim. But you guys, with your bi-weekly stuff, definitely, communicate those concerns that are being raised now.
Mr. Chair.
Vice Chair, Delegate Watson.
Just add one quick thing. I just want to make sure everyone knows that the Secretary has said repeatedly, if you have a constituent who has a serious or unusual or crisis of a problem, that you should be able to get that information to Andrew, and they will make that at the top of the list. So I guess what I'm saying is, don't be afraid to use your leverage to go to Andrew with any problem that is beyond really where it should be. So definitely do that, because they are responding to that if we let them know something is a crisis.
Madam Vice Chair, did you want to kick in here at all, or?
No, it's been a good discussion. Glad we had it, and it's been nice to see everybody's smiling face.
Mr.
Okay.
Chairman,
Sir.
Mr. Chairman, where's C.T. Wilson? That background of his looked like he was in the movies.
I've talked to him about that.
The islands or something?
Delegate Wilson is just special. So we'll leave that at that. Oh, that one was nice. Anyway, guys, I know I've we've gone a little long on this, but I think I see somebody in the chat. I don't want to leave anyone out. Carl, did you, Delia Jackson, did you want to comment?
Yes. I guess I might be on the island here, but I mean, I've been having successes in terms of unemployment issues for my constituents. I mean, to the point where I'm having constituents from other districts contact me. I don't know if they got a list going or something, but we've been really successful. And I agree with Delegate Chi. A lot of constituents, we have had issues with them not answering the phone, or the phone was on vibrate and they didn't hear it, or they called them, I think, up to 3 times on 3 different occasions. And if they don't answer any of those 3, then they go, I guess, to the bottom of the list. But they would always let us know that had happened. And then we would put them back on our spreadsheet and resend it to them. So, I think we also should keep in mind that, these issues, I think, could have arose with anyone who was leading or working in the Department of Labor. I think when you take that into effect, the issues with the system, the issues with the federal government, you don't know which way they're going. There's all these changes. I mean, I think we should consider that as well. Of course, our constituents need their assistance and their monies, but I think we should have a approach of, I guess, what more resources do they need to help them do the job. I mean, I believe they're really working their hardest. I really do believe that. And so I just kind of wanted to put that out there, to the committee.
I'll say one thing, Mr. Chair, if you don't mind, on an unemployment situation. Yeah, some of the cases we've had is that the number often comes in unavailable, and then the constituents would call back, and then they get a busy line. So then they keep coming back and get a busy line. So unfortunately, we've got quite a few of the issues resolved, but then the problem still sort of exists.
In addition, I'm sorry to chime in, but we found out that people are using addresses to vacant homes to apply for unemployment. I had constituents that just brought a vacant house. He has 5 unemployment cards, and he reached out to me, asking me how to handle it. But I think I guess we need to probably bring that up to. I don't know how they can remedy that as well, but I mean, you got to take into account that they got to verify all these people, make sure there's no fraud. I mean, that stuff takes a little extra time. So.
All right. Anyone else? If not, also want to thank Jason and Sarita for joining in and helping us out. Denise for running the board. Laura, again, as always. Certainly Tiffany and Bob came in and joined us towards the end. Our next meeting is 2 weeks from the day, 16th. So that'd be the 23rd. We're trying to do it on the 2nd and 4th Tuesday of every month. I think 23rd. Our last meeting will move up to the Tuesday before Thanksgiving. Is it the Tuesday before Thanksgiving, or is it the week before that? What was that? Well, don't worry about it. We'll get that to you. Just for September and October, know that it's the 2nd and 4th Tuesdays, Wednesdays at 3 o'clock. I tried to put them as late into the afternoon as possible so that you all get your work in and things of that nature before we did this. So that's where we are. Please communicate with me. Like I said, any concerns you have or with the vice chair, when she maybe in the evenings after work for her. I know how busy she is. We'll take your concerns seriously, and we'll try to get it worked out. And like I said, we're going to be ready to roll come January, whatever the format is. We'll be ready to roll. So thank you all so much. Continue to stay safe out there, and I look forward to seeing you all next time. Okay.
All right.
All right, guys. Take care.
Bye.
Okay.